Hi, I'm Dr. Faith at Faith in Motion Performance Therapy. We're located in Hurricane, West Virginia, but we serve people locally and remotely who are dealing with various injuries. And shoulder pain is a common injury that we see, so we're kind of break it down for you. Hopefully, you came to this video today struggling with some shoulder pain and you're looking for some answers, and we're going to provide you with some answers and actionable steps that you can start doing today to hopefully help solve your shoulder pain. Starting with the anatomy of the shoulder joint. There are actually 4 different joints that actually make up the shoulder. You can see them listed on this slide and kind of their locations of the body. The sternoclavicular joint, the acromioclavicular joint, or also called the AC joint. The glenohumeral joint, which is really the ball and socket that everyone thinks of as the actual shoulder. And then you have the one that's not so commonly thought about or treated, and that's the scapulothoracic joint, and that's where the shoulder blade lays along the rib cage. And as you imagine, you're lifting your arm up overhead, that shoulder blade has to rotate and glide along that rib cage to be able to raise your arm overhead. So we've got 4 joints that make up the shoulder joint. So it starts off complicated and it's about to get more complicated. Connecting to either the upper arm bone or the shoulder blade, we've got about 30 different muscles that all connect and work together to stabilize the shoulder blade, move the arm bone, and then assist with arm motion. Because shoulders are so complicated, we can infer that rehab needed to fix shoulder injuries also needs to be complicated. There should not be one cookie cutter approach to shoulder pain. Everyone that's getting treated for shoulder pain in the clinic should not be doing the same exact thing. You really need to pick a clinician that can do a deep dive into your shoulder pain and figure out what the specific issue is, and not just solve your pain, but really solve the root cause of the issue. So just take a look over this slide, look at all the different muscles that connect and assist in the shoulder movement, and then we're going to move on to common types of shoulder injuries. So the 4 kind of common shoulder injuries that we're going to go over in this video, there's more, but these are what we see the most of week in and week out in our clinic, are going to be rotator cuff injuries, impingement syndrome, instability or labrum injuries of the shoulder. And then the 4th category is one that's not really a shoulder injury, but it causes a lot of shoulder pain and weakness. And that's going to be an injury of the neck or the cervical spine that then causes pain and weakness and shoulder-like symptoms. All right, so what is the rotator cuff? The rotator cuff consists of 4 muscles: your supraspinatus, your infraspinatus, your subscapularis, and your teres minor. And these muscles work to kind of fine-tune the movement of your shoulder within that ball and socket joint, and they work to elevate your arm out to the side and also to rotate your arm, which is why it's called the rotator cuff. So what are some common symptoms that might indicate that you have a rotator cuff injury? One of the big hallmark ones that I hear people say all the time is that they have pain sleeping on that shoulder and they can't sleep on that shoulder. Another one is going to be pain with movement, limited movement or a limited range of motion, so not being able to reach as far as you could, as far overhead, behind your back, out to the side or across the car passenger seat. And also weakness in that shoulder compared to your other side.
So a good exercise that Faith and I both really use, especially starting out with rotator cuff injuries, is banded exercise, banded external rotation. You can do this with internal rotation as well. But what we like to do is like an isometric. So if you're really in pain or really flared up, this is should help kind of decrease some of that pain, kind of increase some of that blood flow to the area without causing it more pain or more stress on the muscle. So what I'll have you do is you want to be nice at 90 degrees, so you don't want it to kind of come in, or you don't want to be overextended. You want to be right there about 90 degrees. And then what I'm going to have you do is walk out to where you feel tension on the band here. This is a pretty heavy band, so this is pretty tense, and you'll feel that activation in that muscle there. You'll feel some stress on it without, again, causing too much stress to where you're starting to get painful there. If you start to notice like a 2 or 3 symptomatic pain level, that's about where we want to be. You start to get more, sharp or into that 5, 6, 7 range. That's a little bit too stressful. But if you're in that 2 to 3 range, that's a pretty good place to be tension-wise on the band. And then as you kind of go and feel better and better with that, we'll kind of progress from that as well. So another common injury that we see in the shoulder is what's called shoulder impingement syndrome. A lot of times, if you think about, your shoulder where it connects, so you have your collarbone here, there's a lot of structures that underneath that space that creates between the collarbone and where it connects into like the shoulder blade here. And a lot of times what happens is those structures can either get inflamed or they can get pinched underneath that space, especially when you're overhead and moving your arm overhead. So the common symptoms that you'll notice with shoulder impingement syndrome is you'll have some pinching with specific ranges of motion. So kind of like if you look about my earlier on the slide is that painful arc. So again, you'll feel not a lot of pain up through about here, and then right about 90 degrees, 45 to 90 degrees is when you start to get that pinching and that sharp pain. And then once you get past that 120 degrees area, that's when you'll start to relieve that pain. So if you have pain in this area, or if you have any pain with that internal rotation or even external rotation, it can cause a lot of sharp and pinching pain kind of in the front of your shoulder here. You'll have a lot of pain with overhead movements. So if you're lifting anything heavy, especially in this direction or out to the side, same thing. It's kind of that same idea as you're moving through that range of motion with load. It's going to increase that pain. Again, you'll have some limited range of motion. You won't be able to, rotate all the way through. You'll start to notice some pain with that. And then you'll also have decreased movement of your shoulder blade, which we can kind of talk about here in a little bit. But the shoulder blade won't function as well as it needs to help you get through the full range of motion because of the pain that it causes. Okay, so a good exercise that we both really like for impingement syndrome is called a scapular, I call them a foam roll-up. You can also hear them as like scapular roll-ups or serratus slide-ups. What I'm gonna have you do is I'll use the band to kind of get more attention on some of those rotator cuff muscles in your shoulder. And then what you're going to do is, if you have a foam roller, it helps, it makes it a lot better, but I'll show you a good way to do it without the foam roller as well. But with the foam roller, it kind of helps. What I'll have you do is keep your elbows nice and tucked. You want good tension on the band here. And then with the, pushing down into the foam roller, I want you to drive your elbows kind of up that wall, all the way up as tall as you can, and come right back down. You should get a good activation kind of underneath the shoulder blade here. Again, that's that serratus anterior that really helps with that scapular function that we talked about here a little bit ago. And then if you don't have a foam roller, that's perfectly okay. A towel will work as well. But again, keeping that elbows tucked in, getting good tension on the band, and with the wall, what I'll have you do is again, drive the elbows in through the wall as you slide them up. So you're going all the way up through here, as high as you can go, coming right back down. Now we're going to talk about shoulder labrum injuries. What the labrum is it kind of acts as a suction cup around the humeral head to keep the arm kind of in the socket of the shoulder joint. Some common symptoms that we really see a lot with labrum injuries is you'll notice some clicking and popping within the shoulder joint. You'll have a lot of feeling of instability, especially with doing things, reaching out or having things over your head. You'll have a history of if you've ever had like shoulder dislocation or fallen on that shoulder before. It's a good indication you might have a labrum injury. And then you also will have pain if you're an athlete of any kind of throwing motions where you're coming across this way. You'll have a lot of pain throughout that range of motion as well. A good exercise that we like to start out with working with shoulder instability or even labrum tear injuries is what we call wall ball ADCs. What I'll have you do is start with a lighter ball, kind of like a yoga ball is a really good starting place. You're going to hold it in position with your shoulder, forcing those stabilizer muscles, the rotator cuff muscles, to engage so that they're keeping the joint stable. So what I'll have you do is push through the ball and then go through the alphabet. So starting with A, B, all the way through Z. Okay, keeping in those small range of motions. You don't want to get it too far out where your shoulder is in that unstable position, until you start getting a little bit more comfortable in that smaller range of motion. Another one that we like, so that's more of an open kinetic chain exercise. A good closed chain kinetic exercise would be like a high plank. Again, just holding this for long periods of time. If you get good at the tall plank, you can even move into like a short plank position.
The last type of shoulder injury we're going to go over is really an injury or an issue with the cervical spine or the neck. So a lot of times people can get disc herniations, nerve impingements, stenosis. You've probably heard some of these kind of buzzwords thrown around, but it's essentially an injury to the neck that is injuring or blocking the nerves that supply the muscles of the shoulder. So that's why you get numbness, tingling, weakness, shooting pain, all kinds of odd symptoms that go down the arm, oftentimes even into the forearm and fingers. If you come into our office and you're experiencing these type of symptoms, we oftentimes want to rule in or out the neck versus the shoulder when looking at your shoulder injury. I already briefly mentioned a lot of these symptoms, but here it is on this side. So if you have a neck referred shoulder pain, we're looking at numbness, tingling, burning down the arm. Can have weakness associated with, oftentimes it's more of a severe injury if there's weakness. You might have kind of radiating or dull, achy pain along the shoulder blade. And then also certain neck and head positions can often make that worse. So laying down at night to sleep, you'll get that numbness and tingling that increases. Looking at your computer at desk. So certain positions will make that immediately worse, and then you can get out of that position and it makes it immediately better. We're not going to go over specific exercise for neck-related shoulder pain just because it is a complex condition that we really need to kind of get our hands on you and see kind of what's involved, what structures are involved to be able to prescribe the right exercises. If you found that you are kind of falling into one of these 4 categories of shoulder pain, your next question is probably, well, what do I do now? Who do I go see? How do I solve this shoulder pain? So here at Faith in Motion, we follow a simple 3-step process to get you out of pain and back to doing the activities you love. Our first step is going to be manage. We want to manage your pain and get it under control as quickly as possible. We know that when you're in pain, you're not your best physically or mentally, and you're not able to do what you want to do. So we use a lot of hands-on techniques early in the rehab process, whether it's stretching, massage, or different modalities like cupping, dry needling, acupuncture that help get your pain and inflammation under control so we can move on to step 2. Step 2 is going to be mend. We like to mend, or what we say is fix the root cause of the issue. Oftentimes, the area that you're experiencing pain may not be the root cause. So that's why I said you have to work with a clinician that can really dive deep and find the root cause of your issue. We're movement experts here at Faith in Motion. So we test the joint that you are coming to us complaining about, as well as joints above and below it. We break down your movement and we really find the root cause of what is happening. So during this mend stage, we will start to incorporate corrective exercises. They're kind of low-level, easy exercises to start undoing some of those root causes of that pain. And then thirdly, which is what we think is the most fun stage of rehab, is the move stage. So once your pain is under control, we started correcting some of those underlying issues. We really want to build you up and get you strong and confident in this stage. So once your pain's under control, we've corrected some of those underlying issues, we're going to load you appropriately, make you strong, and get that joint resilient so you don't get hurt again and you don't need to come back and see us. We want to help you achieve your goals as quickly and as healthily as possible and to stay out of pain long term. If you would like to talk to one of our clinicians or expert in shoulder pain and learn more about our 3-step process and how we can help you solve your specific shoulder pain, book a call with us today to get started.